Welcome everyone. Thank you for joining us on Facebook Live. It is the second day of Symposium 2018, and we are very happy to be sitting across from Lynn Grodzki. Lynn is one of those rare therapists who started in the profession with real business acumen and has had a very interesting career trajectory. Lynn, why don't I let you describe your trajectory for us?
Thanks. Well, I came into psychotherapy as a second career, and my earlier career was in business, in the family business, and it was the scrap metal business. So I was the general manager of my father's very large scrap metal plant, multi-million-dollar business, and really taught me a lot about business, I liked business, but I didn't like that business. So I left and got trained as a psychotherapist. I had been in therapy and really wanted to be a therapist. And after I was in therapy for a while, I started to realize that I was missing business, and I decided to get trained as a business coach. So I started as a student in a large coaching school, and I soon realized that the people that needed business help the most were my fellow therapists.
Yes.
This is at the time when managed care was coming in and therapists were really worried. So I started teaching classes and eventually wrote a book that became kind of a best-selling book for therapists called Building Your Ideal Private Practice, published by Norton. And all along still worked as a therapist. So I've been working as a psychotherapist in private practice for 30 years and working as a business coach and a life coach for about 20 years.
Okay, and you're a master certified
Coach. Yes.
What is that designation?
So what that means is that there is one certifying body called the International Coach Federation.
Okay.
And what that means is that I have basically jumped through a lot of hoops over a lot of years, to have my level of certification. For example, you have to have shown 2,500 hours of paid coaching. You have to have had already another level of certification before this and 5 more years on top of that, and then taken exams. So I teach on the faculty of a large coaching school, and coaching is trying very hard to establish itself as a profession with norms and policies and purpose and principles.
Mm-hmm. And are there therapists that are part of that?
Yes.
Okay.
I mean, so anybody can get certified as a coach. You just have to get trained and then go through certification process and exams.
Okay. So you and I have talked about this in the past, and one question I had for you was, can a therapist be a business coach at the same time? And you were saying you like to actually see a little bit of separation there.
Yeah.
So
These are two separate professions. And it really is an ethical issue for a therapist to work with a client or a patient as a therapist and then think at some point they could switch to being that person's coach. Mm-hmm. That's a dual relationship, because the way that coaching is structured and the way that therapy is structured, you're not doing the same thing with a client. You're taking on different roles, and it could be really confusing and unethical.
Let's talk a little bit about the different roles. Can you explain to me how that plays out with actual clients?
Yeah. So, for example, as a therapist, we're working with a very vulnerable population, and they are letting you into their lives and their thoughts, and you begin to have a lot of influence with that person, and there's a certain hierarchy that's in the room where you're kind of the expert in the room, and your words carry a lot of weight. When you're a coach, you have a different role, and you flatten the hierarchy so that you can get more action within the relationship as a process. And for that reason, as a coach, you don't give much advice, and you try to minimize your influence in that way. So imagine if you're coming as a therapist into the coaching role, that would be really confusing for a client, and especially in the work that I do with a client, let's say as a business coach, we're talking about your income, your money, and I don't want the people I'm working with to feel like I have some other information on them
Right.
that would not be easy for them to counter
Okay.
with their own thoughts.
Okay. So your client, you have your business coach clients and your therapy clients.
Yes.
Never the twain.
Never the twain shall meet.
Okay.
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 Except I noticed about a decade ago that working as a therapist, I was hearing myself talk more like a coach and start to use some skills that I would say were more coaching skills when clients presented certain situations to me.
What kinds of situations?
Work issues,
Okay.
urgent problems that they needed to resolve, things that they were procrastinating about, things they needed to take action on. I found that I was bringing some coaching in. I hadn't intended to. I was trained in a lot of other ways as a therapist, but it was starting to kind of morph into my therapy. And I got really curious about that and started to look to see if anything had been written about bringing coaching style or coaching skill into therapy. And there was nothing in the literature about that. So I went back to my own caseload. I started to deconstruct what I was doing. I looked at who was this effective for, who was it not, when was it helpful, when was it not. I looked at cases, I looked at skills, how had I adapted them, and then I started to write. And the first article was in the Psychotherapy Networker in 2012. It was called The Coaching Edge, and I talked a little bit about my journey as a coach and as a therapist and how this work was proceeding. And it got a lot of response. A lot of therapists said, this is what I think I'm doing too. And I'm so glad just organically, just naturally, and I'm so glad that it's being talked about. Okay. And one person said, I feel like this is the trend that we need to move forward on, is to bring the directness and the action of a coach into the experience and the knowledge of therapy.
Do you need to prepare your client for that kind of almost a switch thing? Now we're going to be doing something that's might sound a little different, or I'm going to push you in this direction a bit.
So what I've done since then, since 2012, is I've written a book where I've really created a model that helps therapists know how to set things up and how to use a series of skills. And in that setup, I want therapists to be able to assess clients, to know if they're working with the right clients for this model or not. Because you can get in trouble with a coaching style in therapy if the client doesn't understand what you're doing. It's not right for all diagnoses. It's not right for all issues or challenges. There's it's an additive model to add to what you already know to do as a therapist.
Okay. So if someone presents with a challenge, now you've got both sets of expertise in your head. Do you say to yourself, this is what they're presenting, maybe even first session, this is what they're presenting. The coach in me is going to tackle this, or the therapist in me is going to tackle it? Or do you think to yourself, okay, now I have this combination effect that I'm going to use on them?
That's a great question. If I want to bring a coaching style into therapy, using the model that I've developed, it starts with asking the client if that's what they want.
Okay.
Because a coaching style presumes a very client-centered model that gets the client involved. So I would say to a client, here's a way that we could work together. Is that what you'd like? Would you like me to work in a more proactive way? Would you like me to be more of a blank slate, just so you could talk? Would you like me to voice opinions? Do you want therapy that's faster or slower? Because I could do both.
And what do they say by and large?
Well, it's really interesting. A lot of times clients will say, that's exactly what I want, is something more proactive and directive, but not always. A client who's coming in and saying, I'm grieving, or this has been a problem for a very long time. I don't need it to be fast. I want to develop insight. I want to know what this is about for me. So if I get a client like that, I'm not going to use a coaching style with them. I'm going to use another model that I know as a therapist, maybe something psychodynamic or a narrative therapy.
Okay.
Okay.
So let's talk about a few, or maybe just even one example of applying a coaching skill to practice.
Okay. So the first skill, after I let me say it this way. After I help therapists understand how to assess clients and how to flatten the hierarchy of their role so they can be more collaborative with clients, and there's a certain ways to do that, and then how to set up a session so that you could see results in every session. So that it's going to, so all of this setup is really important for this model.
Okay.
Then there's skills to use, and I give therapists 9 adapted coaching skills that I think work very well in therapy. And the first skill is how to ask effective questions. This is a really interesting skill that comes from coaching. And in coaching, a lot of times you might have a single session with a client. You've got one shot to make things happen. And part of the way that you're trained to do that is in the questions that you ask. The questions are usually designed to be clear, open-ended, direct, and questions that would give a client a chance to have an aha moment, to deepen insight, or to come to some new thinking. As a therapist, you're not trained to do that. We ask a lot of questions as a therapist, but they're not usually that intentional. They're questions like, well, how do you feel about that? Or can you tell me more about that?
Those sound like therapy questions. Yeah. What does a coaching question sound like?
So here's an example of a coaching question. This week I had a client in my office who was telling me that in her life, she always comes last. And I said to her, what would it take for you to come first in here with me today? And she was very surprised at that. And it took a while for her to think about what would that even mean in this relationship. And then after we talked about that, I could follow it up by saying, and what would it take for you to come first in your life this week? You know, now we're making it really pointed, very tangible for her to move forward in this way that's very different from how she usually behaves. That would be a kind of a coaching style of a question.
Okay.
Okay.
And then when she comes back the next week, is she going to check in with you about what she did over the course of that week?
Yes. So given the structure of the session, we're going to have a session that has a beginning, a middle, and an end. And in the end of the session, I'm leaving time for the client to tell me what they're taking away from our session, what they're going to do with what they're taking away over the week, and how I can support them in this. And that's very different too. The idea that a therapist with a coaching style would say to a client, my involvement with you extends to the fact that I want to support you in the goals that you're trying to achieve. What could I do that you would feel like was support? And a lot of times what that says to a client is, how can I use you for accountability as my therapist? And how can I check in with you in the way that's good for the client to keep moving things forward?
Now, have you done this long enough that you have a client who says, every problem I present now, I would like a solution-based coaching kind of style?
Yes, I have clients who really like this, who feel like this is a different kind of therapy, one that is works for them. And what's great about this is because I'm a therapist like so many other therapists who know so many different ways of working, you can move in and out of this style. You're not married to this. So when somebody wants to move forward on something, I can bring this style in when it's appropriate. And when they're dealing with some anxiety, maybe I'm going to use one of these great anxiety methods that Peg Warenberg uses, right? Or maybe we're going to work with some depression, or maybe we're going to work with some history, and then when they're feeling more functional, we're going to go back to this style and use some skills in this style that again help them to set goals and move forward.
So I don't know if we know this now through research, but do we know if we use therapy with a coaching edge, do more coaching with our clients, if the rates of recovery, do we know if they improve? Do we know if the accountability helps make those changes? Because
Well, I know what my caseload shows.
What your caseload shows.
And this is a brand new model. The book is just out this week. Yeah, so I'm hoping that it starts a conversation. That's what I really want this book to do. I want it to make this style more intentional for therapists and more rigorous for them, so that they use this kind of style with a lot more grace and in a better way. And then I'm hoping that we all begin to track and see what the results are. And that it can become evidence-based. It's evidence-based in my practice because I track. And that's what a lot of therapists are learning to do right now, is to track, to see their results. And this is a great model for that.
That'll be really interesting to watch. Okay, and then last question. Some clients might be well suited for this. Some clients definitely not well suited. Can you make that assessment early on?
You can, because you oftentimes clients come in knowing enough information about themselves that you can start to make a diagnosis with them. And the other thing we're looking at, so I'm looking at client preference, who wants this, client diagnosis, and client functionality. And in order to use this kind of a more directive, faster-paced process where the therapist is more collaborative, you need a client who's functional enough to be accessible to that. You know, if they're deep in trauma, this is not appropriate. They're too frozen with that. If they're having PTSD, if there's an Axis 2 diagnosis, this is not the therapy of choice. But for the worried well clients, for clients who come in who you know, there's a client that I was writing about in the book, a lost millennial, 30-year-old, kind of low-level job, very smart guy, still living with his parents, and his parents had given him 6 months to get out and be on his own. And I don't want him to be on the street, right? He needs to get moving. He needs to get going. And he comes in saying, I know what I need to do, I just can't get myself to do it. And it's not that he didn't have some anxiety and depression that I was working with him on too, but he needed to make some change. This is a great model for him.
Now, I'm just thinking about millennials, and I'm also thinking about, since they're so well informed about therapy and their options, and also know that there are lots of options there, maybe they have some idea that they want to get through this quickly. They're not thinking about laying back on the couch for 7 years. This seems like maybe also a generational preference.
It's attractive to them. I have it up on my website, and it's very attractive to a lot of younger people.
So a therapist who wants to start incorporating this into their practice, they need to be careful with their clients, they need to be clear, they can find information from you.
Yes, they find this whole model with all of these ways to structure things, with skills that they can use, and it's just-in-time learning, where you can read a skill, and I've given you a case about the skill and an exercise and a way to integrate it into your work, and so as soon as you're ready, you can use that skill without further training.
So there's no need for them to start thinking themselves as, sort of in the way that you've taken your career, I'm a therapist and I'm a coach.
No.
Rather, I remain a therapist.
And I bring in this coaching style. And you know, nobody owns coaching. Let's just say that. Therapists have been using a coaching style probably since the 1950s, since Maslow came up with his hierarchy, or since Carl Roger had his unconditional regard. These were all coaching styles. It's just that in the last 40 years, coaching began to define itself as a profession, and then it moved on to develop some of its own skill set. So coaching, I think, borrowed some from therapy and personal growth, and I'm borrowing back, but I'm adapting it so it fits really well into the principles and the purpose and the ethics of psychotherapy.
And the therapists that you've taught to use this, who don't have your same, say, business background, might not look
or even coaching background.
Has it been a strange new reality for them, or has it?
It's natural. These are things that we can naturally do. It's just they have more awareness about this now, and for them, it's more like, oh, That makes sense.
So an added gift.
An added gift. Yeah.
Well, Lynn, thank you so much. This is so interesting, and we can't wait to hear you say more about it here at the symposium.
Thank you.
And we'll look for your book.
Thanks.
Thanks, everyone.